Good morning. Welcome, everyone. Thanks for joining us today. My name is Dr. Louise Ivers. I'm the director of the Harvard Global Health Institute and a professor at Harvard Medical School. I'm really delighted to welcome everyone today to the Harvard Global Health Institute's brand new virtual series called Coffee Sessions. This series is designed to explore and discuss the role of partnerships and collaboration when working to advance global health equity, something that's really important to us to learn about and talk about. So we welcome you to our session today, and we hope we're going to see everybody in this same time every month. Today, I'm really delighted to be joined by Julie Rosenberg and Biliamin Popoola, who are going to be presenting on better evidence, better training, better care, supporting current and future clinicians in Africa to use evidence-based digital tools. The session's being recorded. We're going to make it available on the HCHI website in the coming days. And we are going to have time at the end of the presentation for questions from the attendees. So please go ahead and submit a question through the Q&A feature in the webinar, and we'll get to those later on. So I'll also mention that the full bios for our speakers are available on the website. So I'm just giving a touch of introduction about them. But Biliamin Popoola is an academic, librarian, researcher, and knowledge management professional from Nigeria. He's currently a PhD candidate at the University of Ilorin, Nigeria. He works as the Systems, Scholarly Communications, and Evidence-Based Medicine Librarian at the University of Medical Sciences, Ondo City, Nigeria, where he also serves as a champion for the Better Evidence for Training program at the institution. Biliamin is a fellow of the Carnegie Next Generation Librarians Fellowship Program at the University of Pretoria, South Africa, and a recipient of the Cunningham International Fellowship by the Medical Library Association USA. Welcome. Julie Rosenberg is the Associate Director of Better Evidence at Ariadne Labs, a program working to help current and future healthcare providers access the latest clinical knowledge at the front lines of care delivery through digital tools. Julie is also the Deputy Director of the Global Health Delivery Project at Harvard and a lecturer in Global Health and Social Medicine at Harvard Medical School. Welcome to both of you. Thank you so much. And I will pass over to you both.
Great. Thank you, Louise, and thank you to the Harvard Global Health Institute for having us here today to share more with you about our work and how we work together. So that we were really moved by the symposium and some of the ideas shared there about the importance of partnerships. And so we're going to share a little bit about how we've made them work on behalf of all the partners that involved in our work. So we're also just honored and privileged to be representing everyone we work with. And we hope that you'll leave this conversation with a sense of hope and empowerment. The idea that we're in this together and have to work together to move the needle towards justice and closer to health equity. So as Louise said, I'm Julie Rosenberg. I'm just going to introduce myself, and then I'm going to turn it over to Biliamin to tell you more about the work we do. And then we'll talk just about the importance of partnership to both of us and some of our thoughts and reflections, and then we'll turn it back to you for questions. So my first exposure to the importance and to the value of partnerships was in Peru after high school, when I volunteered with Socios en Salud, or Partners in Health, in the sprawling shanty town north of Lima. And I may have even roomed with Louise at some point there. At the time, my partners were really the local community health workers, and I accompanied them daily up these steep, dusty hills. We carried supplies. I was observing and really just trying to see where I could help. And, while what I was able to do was nearly invisible relative to the need, being there and accompanying the frontline workforce daily meant a lot to me. And I learned more than I ever could have imagined. I also developed relationships that I still maintain today, more than 2 decades later. So while it's been a while since I first started, I think my aim of supporting implementers, making sure they have the information, the tools they need to make better decisions as they serve their communities has not changed. So I'll hand it over to Biliamin at this point to share more about some of the work we're doing along those lines, and with that goal in mind. So over to you, Biliamin.
Thank you, Julie, and thank you, everyone. Thank you, SGHI, for having us. I'm Biliamin Popoola, as I've been introduced, from the University of Medical Sciences, Nigeria. And let me start by saying that for me, partnership, it's for someone that's from the kind of who is from the kind of background that I have. The partnership is more like a lifeline when it comes to survival. Because when you're from a resource-limited setting, you have to come in partnership with other people to share your problems, to solve problems, to solve challenges. So it's more like saying you've got to share your yam to get bread. So you've got to come together. So partnership is always key for us in this kind of setting that I am from. And that is more or less the crux of the discussion today, that when we come together, a lot can be achieved when we leverage on individual strengths. And that is like the crux of the matter today. So today we'll be sharing with you lessons from the Better Evidence Program. Can I have this slide up, please? Julie? Yeah, thank you. So today we'll be talking to you about the Better Evidence Program, which is based at the Ariadne Labs, and how the program is trying to actually help current and future clinicians, future health workforce, to make sure they are able to access and use evidence in decision-making in the work they are doing in our low resource setting. So can we have the slide up, please? So we are going to give you a brief background about what the Better Evidence for Training program is.
Are you not seeing the slide?
Not yet.
Oh, I'm sorry. Yeah. We missed okay. Sorry, despite our best tech checks.
Okay.
Is it showing?
No. Okay, good. Yeah, it's open. Thank you. Okay, so the Better Evidence for Training program is actually something that came up to make sure to assist the workforce of healthcare in low resource settings to be able to access information and to be able to actually use information, use evidence in whatever decision they are making. And why is it important that they use evidence? Why is it important that they have access to evidence? That's because we are now in a situation where that we can refer to as information overload. So the slide you have on the screen is telling us about the vision and mission, but now we are not saying why do we need evidence? Evidence is important in resource-limited settings because despite the fact that there are global challenges, there are universal challenges in terms of healthcare, the massive amount of information that is being churned out daily it makes it important for people in low resource settings to be able to access evidence and be able to make decisions based on this evidence. We have situations in low resource settings whereby we have sicker patients because they are presenting late to the hospital, and because because of the socioeconomic because of some socioeconomic reasons. And this is compounded with the fact that there are fewer resources, there are fewer doctors to attend to them. So the little number of doctors and the little number of resources that are available have to be maximized. And one of them is actually to make sure there is access to evidence to make decisions and reduce medical errors. So it was learned that one of the ways to assist clinicians and other healthcare workers is actually to provide digital tools for them to assess the evidence they need for their to make decisions while they are attending to their patients. And evidence-based digital tools have actually been known to be a source of clinically relevant information. They are easily searchable. And one of these, one of the premier clinical decision data tool is UpToDate, which has actually been confirmed to improve healthcare and quality of care, and also shorten the the length of stay in the hospital, and also lower mortality rate. This has been well documented in literature. So these digital tools are what the Better Evidence Program presents to healthcare workforce in low resource settings to enable them to also work towards health equity, so that people in their community can also have access to better care and better access to healthcare. But there's a challenge. Despite that, these tools have been known to be, they have been proven in intervention in healthcare settings. There's a challenge in which the tools are not widely used in low resource settings, mostly because of the cost implications. So while the users in the global north are making use of this, in fact, as reported, more than about 90% of US medical schools have access to tools like UpToDate, but when you come to the other side, the low resource settings, there are barriers to these kind of things, such as cost, lack of awareness, and all that. So this actually create the challenge that, okay, despite that these tools are useful, where they will make much impact, where they will be more impactful, the access is actually limited. And that is where the Better Evidence partnership comes in. Next slide, please. So the model, this is the Better Evidence collaboration model, which speaks to the fact that there's a digital tool provider which is coming up with, which are the providers who are coming up with the different digital tools for that clinicians and other healthcare professionals can use for evidence. And we have the Better Evidence team in the middle who are coordinating the model, the partnership. And the medical schools at the far right. So we have these three tripods, like a tripod stand framework, where we have the digital tool provider, the Better Evidence, and the medical school. And each one of these partners have individual roles, while the providers are building and maintaining the tools. The Better Evidence team are identifying the schools that will be eligible for the donations, the access donations to these tools, and also coordinating the whole program and training those who are making it possible in the local settings. So what the Better Evidence team do is that, so to make this possible, thank you. To make this possible, the Better Evidence team ran a pilot study, a cohort study back in 2015. And the result of the study actually proved that medical students who are exposed to the use of these digital tools were able to continue to make use of them thereafter when they are in practice, when they're during their clinical practice time. So it shows that if students, trainees, residents, undergrad students are exposed to these tools early enough, they can take it up and start using it while in clinical practice. And that's actually that actually became a starting point for the Better Evidence program. That this was piloted just in two institutions in Africa. But it bets the Better Evidence program that, okay, we can do this for more program. We can bring more people into this, and that was how the Better Evidence program started. Let's move on, please. So the program started with a few institutions, and then it continues to grow by engaging and enlisting more people into the program. What the Better Evidence team does is to actually facilitate access to the digital clinical evidence tools, and also to coordinate the program. However, because of the logistic of coordinating the program on the ground, because for you to, after the launch of the program, the Better Evidence team realized that the initial training, because the Better Evidence team had to travel all the way from the US to Africa, the initial orientation that they gave was not enough. The providing access was not enough. We needed someone to be on the ground to train the users, to communicate with the users, to engage the users, to support them. And that was what gave birth to, the model whereby there are local champions appointed in each institution. At the start of the program, they were in local champions. But as the program demand, as the need demand, we saw that, okay, there's need to include local champions. So institutions were asked to appoint two champions at their institutions to train the users, to communicate with them and all that. And this was done, initially it wasn't a prerequisite to be on the Better Evidence program. But when we started seeing the impact of these local champions, we discovered that, and it actually became a requirement that institutions should appoint champions. And these champions are librarians, they are clinicians, faculty members, IT specialists, and all that. So institutions are allowed to appoint 2 people, and I am one of the champions for my institutions from my own university here in Nigeria. So we have over 100 local champions currently working, and they are engaging together in a monthly webinar and discussion hour. We are having community of practice, sharing knowledge, and they are representing about 59 schools in Africa, cut across the West, the East, the South, and Africa. And with that, we've been able to provide access to the digital tools for more than 89,000 students, residents, faculties in 16 countries. And that is where the impact is actually coming together, because we have been able to harness the power of local champions to actually scale the work to build more impact for the work. So that's what the champions do. They engage, they facilitate, they communicate, and they support the users. They train them, they support the users on ground. So last August, the Better Evidence program actually adapted further while trying to evolve and while trying to make sure that the local champions take more ownership of the program and are able to actually direct the model, the partnership model. So a steering committee was launched in August 2023. About 13 of us. I'm presently the president of the steering committee. And then the steering committee is the one coordinating the affairs of the champions engagement and all that, the webinars and all that at the moment, which is actually making sure that the people who are local champions working at the local level actually have a voice within the whole program model and the decision-making process of the Better Evidence program. Aside the champions, we also have the US-based teams. The US-based team based in Boston, the Better Evidence-based team, the Better Evidence team in the US. And that's okay. We have them on the screen right now. That's the headshot. 5 of them, and this team is really doing a lot. While we on the ground are working as the foot soldiers, training the users, engaging with the users. They are like the brain of the whole thing, giving us the knowledge, training us, giving us the support and all the tactical ideas that we need to get this done. So so that's the whole brief, that's the background of what we're doing within the Better Evidence program. And I'll turn it over to Julie now to continue the conversation. Thank you very much.
Great. Thank you, Biliamin. It's a lot to cover quickly, so we're looking forward to taking questions from everyone.
Yeah.
But with that background on what we're trying to do and how we're doing it, we're going to talk a little bit more in depth about some of the other issues that we've sort of faced building partnerships, what we've learned, and just some other thoughts. So feel free to add questions to the chat as we chat. But I think Biliamin did a really nice job alluding to some of the key strategies that have enabled our success. I think he mentioned some clear shared goals, a shared mission. We have clarity of roles, who's doing what, clear structure and organization. So even within the steering committee, everyone has a very specific role about who's in charge of the webinars, who's in charge of discussions, who's in charge of outreach. That has really enabled everyone to work together well. I think we've both been able to see and leverage each other's strengths, and the benefits that come from where each of us sit. There is constant communication. He mentioned an online community of practice. There's WhatsApp groups, there's Telegram, there's a lot of different modes. We meet in person several times a month. And we share progress and updates, so reports from actually the tool providers on use and uptake. We acknowledge successes and we celebrate the wins as we go. So there's just a lot of knowledge sharing and information exchange. And So I'll turn it over to you, Billy. I mean, those were just some of the pieces I think that I pulled from your description of the program, but what else would you say have been the key strategies to building successful partnerships, not just with our team, but among the champions?
Okay, thank you very much, Julie. To add to what you've actually been able to harness from the discussion so far, I would say one important strategy is openness. Number one is openness. Partners in every partnership, the components must be open to one another. You've got to make sure that everyone understands the goals that you are trying to achieve. So every partner must be open about what they are trying to achieve in the partnership, so that this will not create a challenge at the long run, that this is not what I'm expecting, this is what this is what I was expecting. So we have to be open. And secondly, there must be ownership. Ownership is very important. And when we are in any partnership, you've got to make sure that every component of the partnership have a sense of have a sense of belonging in the partnership. And that's part of what I've seen in the Better Evidence program. The champion says that they take ownership of the partnership, and it's really making them to be more enthused to be part of the program, to work for the program. So in partnership, in a global partnership and whatever other partnership, there must be ownership for it to actually is the ownership that will make sure that everyone who is in the partnership is overlooking the hurdles, and they have just focused at the finish line. The hurdles, whatever challenge they are facing, they will not mind, because they feel it's their own, and they know that the successes and the failure of that partnership is both individual and collective. So the last thing I may add as a strategy is in terms of adaptation. It's important to know that a partnership may not be fully formed from start. You may have to evolve over time, just as the Better Evidence program evolved. At a point, there was a need to include champions. At a point, there was a need to include steering committee. So there will be a lot of evolution and adaptation while a partnership is ongoing. So while the goals should be clear, the processes should not be cast in stone, because you definitely, sometimes there will be need for a detour, there will be need for a remodeling. I mean, there will be need for in fact, there could be need for re-envisioning of the whole partnership. So it's important for us to also take adaptation into the. So by and large, I would say ownership, adaptation, and openness are other strategies that are important for a partnership. Thank you, Julie.
Yeah, great. And I think, all of those things that you just mentioned really add to trust. So, transparency, honesty, time, also sort of committing and knowing that we're in it for the long haul, I think probably contributes to good partnerships, and a sense of trust between the partners.
Yeah, that's correct. Yeah.
Great. One of the other comments that Hai asked us about is, how the partnership has reimagined the work that we do. And I don't think we could have imagined the work without dedicated partners, but we didn't really know who the partners would be or how we would engage them. And in some ways, we really stumbled across medical librarians as partners and as a critical piece of the healthcare system. And they're so often overlooked. And I think we think about essential information or evidence in the same way many people in global health think about essential medicines or essential diagnostics, that you cannot provide quality care without essential evidence or information. And librarians are the gatekeepers of that information. So, I think recently with the global pandemic, what became called the infodemic, or the spread of misinformation around the world, and the harm that some of that caused, was really highlighted, and really highlighted the importance of trusted sources of information, both for the medical workforce and for the community, or the librarians. So I think in that way, we've learned and reimagined sort of health and medical librarians as essential parts of the healthcare system, and really need to empower them as public health professionals and engage them as as many partnerships as possible. So I think that's one of the big ways that I've reimagined some of the work. But Biliamin, I'm curious to hear from you too. How has this work, how has our partnership reimagined the work that you do?
Yeah, thank you, Julie. That's so thoughtful of you thinking about librarians that way. I agree with librarians are often overlooked. I'm really happy that you thought in that line. Well, for me, this partnership has actually made me to reimagine the kind of work I do. First, in terms of the fact that great things can be done in small places. I mean, you don't have to wait till you are in big places before you can do great things. That's one of the things that have really emerging from the whole of this. We may not be able to change the whole world at a time, but if we have trickles of effort here and there, they can coalesce into a great impact. And that's what I'm seeing in the Better Evidence Program. I think that's something that I've gotten the imagination that, okay, you don't have to wait till you are in a big setting. You can start local, and that local is actually part of the big picture you are looking at. And secondly, just as you alluded to, is that it now makes me to imagine myself as an eligible component of a global health assignment of a global health program. I'm able to now say, okay, I see myself now as a librarian to be more eligible to participate in global health programs. And I think, just as you said, that librarians could have hidden skills. There could be hidden skills that librarians could bring in, which could determine the success of a program, or maybe even determine the scale of the impact of the program. So that's another reimagination for me from this whole work. And lastly, I will add that this partnership has actually enabled me to reimagine leadership, because now it's clearer to me that leadership is more like a lifeline for any partnership. I've learned that when leadership finds its way to you, you've got to just roll up your sleeves and be ready to work. So these are the things I've reimagined in addition to yours, Julie.
Yeah, thank you. And I mean, I have to say, Billy, I mean, you have made leadership look easy. You have not missed a beat. And you mentioned just yesterday, you had a baby boy 1 week ago, and I wouldn't have known. You have worked so incredibly hard. So thank you for that. We were really lucky. I think some of it's luck and like who you find, who you encounter also. But, you know, I think partnerships aren't always smooth. I mean, it does take hard work. And you know, there can be some bumps along the road.
Sure.
And so I'm, you know, just interested to hear more from you about what you think the challenges have been for the partnership.
Well, yeah, thank you. For me, yeah, you are correct. There definitely will be bumps when you are in any partnership. There will be challenges. And for me, I may start with the home front, where I'm working as a champion within my institution, whereby you discover that you are not even immune to the social, political, economic events that are happening around you. Even though you have an intervention, you have a program to implement, you have an idea to implement, the things going on around you may have confounding effects on your plan already. So there are situations in recent times, we have situations with the internet becoming less reliable. We have issues with brain drain, whereby the people who are supposed to be using these tools are actually migrating in search of greener pasture. So this is one bump for us, because we are trying to make sure we give ourselves to the service. However, there are events happening here and there within the social sphere, within the political sphere, within the economic sphere, that actually affects what you do. And secondly, another bump is that when you're working with a pool of champions who are from different backgrounds, you have people from different countries, different culture, you have people of different professional engagement. You definitely will be, as a leader, you definitely will need to be sure that you are like a backup, a default backup for every activity that is going on. And that pushes a lot of stress on you one way or the other sometimes, especially if you have some team members who are not performing. And in fact, for those team members who are not performing, you've got to be respectfully decisive about them. So this managing a pool of backup of, a pool of people from different backgrounds is also some little challenge. So every leader must be clear with that. You definitely, if you have human, if the human component will always come in along the line, and you definitely will have to attend to that. So I don't know what you think, Julie. For you, what have been the challenges?
Yeah, thank you. I mean, I think you hit on some of them. And I think, those of you who are in relationships or partnering with one person know that it can be hard. And in our case, we're talking about 60 institutions. We're having 11 more join. This year, we have 130 champions, 16 countries, different languages, different banking systems, different types of professional accreditation bodies for each medical school, as well as what counts as professional development or CME. So we're just working across really diverse infrastructure. And some bumps come with this. So I think the challenge has been, how do we build infrastructure and standardize our systems across these different contexts? And we've done a fair amount of research and planning to try to mitigate the challenges, but the main challenge has really been a global payment system. So wiring money to over 100 champions from within a complex administrative system like the one we're at, that's not really set up for this kind of project, has been hard. So one missed banking or routing number can lead to months of delays and challenges and just time that we're ending up putting into things like that when we'd really rather be having this type of conversation. So I mean, fortunately, champions have been understanding and really also helped in troubleshooting and problem solving. And I think that's one of the greatest strengths of our partnership, is that people on the ground are problem solving, we're working together at every level. But, I think it has caused some tension at times, some bumps, as we figure out, more efficient ways to build that financial infrastructure, specifically.
Thank you.
Yeah, so I think, just the final question here for me is really about sort of in solving some of these problems, in working together, what have you learned from the collaboration? I know we're past time here, so if you want to give a sort of a little summary, and then we'll turn to the audience for what they want to hear about.
All right, thank you. Well, it has been a lot of lessons being part of the Better Evidence program. There's been a lot of capacity building and all that. But if I could just summarize maybe some of the key lessons I've learned, maybe within 4 points, I'll say number one, I've learned that a good team plus a good strategy is an ingredient for a good impact. You have a good team, you have a good strategy, you are heading towards a good impact. And that's what I've seen in the BE program. I've had some moments of thank yous from our users who feel privileged that they have access to these tools, and they are thanking me. Well, not me, they are thanking the system, they are thanking the program. Yeah. So if the BE program is not well structured with a good team and a good strategy, we probably wouldn't have that. And secondly, as I mentioned earlier, is that another lesson is that great things can be done from small places. That's another lesson for me. A lot of little efforts here and there can be combined together, coalesce together into great impact. So we don't have to wait till we have all the resources, we have all that we need at a bigger level before we start. So we have to start small wherever we are and do something with whatever resources we have. So number 3 is that I've also learned that collaboration in healthcare it's not just about syringes, it's not just about the lab coats, it's not just about the medications, the lab tests and all that. Healthcare system requires expertise that are diverse. So a lot of people can come in, and just as you mentioned about librarians, a lot of people have skills that they can bring into healthcare. So healthcare system should not just be focused on the primary healthcare professionals. That's another lesson for me, because there are other people who have skills and expertise that they can bring in into whatever we are doing. And lastly, what I would say is a lesson for me is that the leaders are very important in every partnership that we have. The leader must understand the goals and vision of any program, and they are the one that will drive others towards those vision and those goals. So I've seen clearly that the roles of the leader is very crucial, and it must not be left to chance. So in every partnership, you must make sure that you appoint a leader who is able to drive you towards the goal, who is able to drive you towards the vision. And the leader must imbue in themselves, they must build in themselves some learning structure. You must learn, you must build in yourself teamwork, you must build in yourself proactiveness, you must build in yourself collegiality and respect. So these are the important things that I think I've learned from this partnership. And I believe you must have also learned some things that you want to share, Julie.
Yeah, thank you, Biliamin. I think you've described a lot of this, I mean, beautifully. So I don't want to say too much, but I think some of what you described is sort of this idea of accompaniment and going hand in hand. And what I see here is like virtual accompaniment. I mean, we're not sitting together, we're not going there, we are distributing these digital tools. And so it's sort of taking this concept and really applying it in a new way. And you know, this is just in honor of the late Paul Farmer. You know, he said to accompany someone is to go with him or her, to break bread together, to be present on a journey with a beginning and an end. It's much more about sticking with a task until it's deemed completed by the person or person being accompanied rather than by the accompaniator. And so I think that's some of what you described in that vision of leadership is it's not always the sort of leader on a pedestal that we think about, but it's sort of sticking together and working through those hard times and the bumps that come up. So, you know, I'll just sort of wrap up there with this idea that we're so grateful to be sort of accompanying you, to have you accompanying us. It's this sort of mutual journey that we've shared. So thank you for joining. Thanks to Hai for the opportunity, and I'll turn it back to Louise to take some questions.
Thank you very much.
Oh, thank you both. Wow, that was just fantastic. And we have lots of really positive affirmations in the chat, and everybody's been really enjoying it. We only have a few minutes left for questions, but we have a lot of questions. So what I'm going to do is try to kind of bin together two types of questions or three types of questions coming in. One is people are wondering how could they get involved? They're in East Africa, can medical students join, etc. But I think what we'll do is make sure that people can receive the information about the Better Evidence Project and Ariadne Labs, and maybe they can sign up for your newsletter and get some more information like that. So I'll pose questions to you. One is like kind of technical questions. How do you choose what digital formats you're going to use, up to date or others, and how do the challenges around access to infrastructure like internet and etc., how do those weigh into the projects? Those are some technical questions. And then I'd love to also maybe ask you one more question about your partnership, because I think it's so nice to be sitting observing this lovely dynamic between the two of you. It seems nice, and you've given us lessons about shared goals and shared mission and clear roles and openness and transparency. How do you keep that relationship of the partnership open for those discussions so that you can get through those difficult times when they come, especially when you're so busy with the operations? You know, so I'll pose you those two questions in our last 5 minutes. I think maybe you could comment.
Yeah, thank you. So on the technical side, so this is one part of sort of our portfolio, I would say. And so the goal of the Better Evidence for Training is to prepare people to use better evidence in practice. And so a large part of our work is also direct to clinicians. So supporting clinicians in limited resource settings to access better evidence, which you can learn about on our website. And as far as selecting the tools, we've been fortunate to be working with UpToDate since about 2009. They've been excellent partners. Part of that is that there is actual evidence and research behind the tool that shows it leads to better outcomes, just like any intervention. You know, we see this as such. So that's part of it is we know that it works. We know there's an impact on patient outcomes. So that's part of why we've selected it. There have been others that, you know, may or may not work. I think we're seeing with AI, there's going to be sort of a boom of tools, and how do you select the ones to use, to push, to support? Hopefully we can generate some evidence and research to sort of guide those decisions. So hopefully that answers the technical side. For those who are asking about where we work and such, all of that is on our website. This program is currently in 16 countries, going to be in 18 next year. And we're in about 172 countries on the other side with the clinicians. And I'm sorry, the second part of the question, do you want to take it, Biliamin?
The question speaks to how we keep an open communication despite all these challenges. So I would say the BE program, the Better Evidence program, that's one of the very important things. And I mentioned this, that the openness is very important. We have a monthly open hour discussion whereby every champion is allowed to come in and speak their mind, tell us what is going on, chime in at any time. It's more or less like a no rule situation. You're free to jump in at any time, tell us your fears, tell us what is working for you, tell us what is not working. So we come together as a team every month, having an open, aside from the webinars that we have the open hour discussion whereby everyone is freely, they have free access to get their mind input to for whatever they want to say. And as I also mentioned, we have the community of practice platform, which we wish to communicate very frequently. More or less every day you must be on Basecamp to check what is going on. So people are chiming in a lot of information every day. So this keeps the communication going. I think the important is to make sure that you have an open channel of communication at all points in time. So when that channel is open and people are able to chime in at any time, then we can come together like crowd solving problems, crowd discussing issues. And I think that's what has been working for us. Thank you.
Yeah, and we work really closely together to solve problems. Like there's not, I think, and I think sort of work hand in hand. You need this, we'll help you with this. We see this, okay, let us do that for you. So it's sort of like we work in service to each other as well. And so I think there's that shared commitment and trust that, you know, no one's sort of there to look for problems. We're there to solve problems, and sort of that shared commitment. And then I think the other thing I would say is that we really want our champions to be successful, not only in this work, but in sort of their professional roles. And so, you know, that type of support, I think, has not only helped the trust, but sort of help us work through hard times, that there are benefits to working together, and we can help you in one way, even if we can't help in another way. And so that type of support, I think, you know, probably helps us get through some of the challenges, you know.
Yeah, Biliamin, you said, I want to see if I got your saying right, because at the beginning you said you've got to share your yam to get some bread. Is
That's it.
yeah, is that a proverb? I really liked it. I haven't heard that one before.
Yeah, it's a proverb. It's a proverb in my local dialect that I translated into English. You got to put your yam to get bread.
Yeah, I like that. You got to work together. So we have just 1 minute left. So do you have anything that you really wanted to say that you didn't get a chance to say, or any closing comment? I'll give each of you kind of 30 seconds to wrap up. It's been so informative, but maybe there was something else you want to share.
I just want to say some of the comments in the chat are from our other champions. So that means a lot to have you all here. Thank you for joining us. Thank you for your support. You've been so supportive of our work as well. So that's just really meaningful, and we're grateful to be working with you. So thanks for coming today.
Yeah, thank you, Julie. For me, I would say global health programs require local partnership. You have global health programs, you need people on the ground to be doing, partner with people on the ground. That is very key for any global health program to be successful. So thank you for having us. That will be my closing remark.
Oh, you two are just fabulous, and your whole crew and your champions online for joining and kind of helping to elevate this first series. This was exactly what we were hoping to get at with these conversations. So I want to thank you both very, very much. All of the Better Evidence project team and champions who are online. Thanks for joining us as well as the other visitors. And I'll ask everyone to mark your calendars for May 31st at the same time, same place, for the next session in our series, our coffee sessions. Thank you, everyone. Have a really great day.